Good morning, everyone. It's just wonderful to look out and see all your faces. On behalf of the Alzheimer's Association and Jewish Family and Children's Service, I'm just delighted to welcome you here today. I was informed a minute ago I had this microphone upside down, so I'm going to just check if I got it right, Gino? Okay, wonderful. Because the demand for this event really exceeded our expectations, we're having it videotaped so that we'll be able to share the content with your work teams and with people who couldn't be here today. My name is Beth Salzberg, and I'm the manager of the Alzheimer's and Related Disorders Family Support Program here at Jewish Family and Children's Service. I think we've arrived at a moment when so many people in different sectors of our communities are realizing that we need to reshape our communities to better support and include people living with dementia and their care partners. I think the fact that this event sold out 3 weeks ago is just one small piece of evidence to that, along with the amazing work that many of you do every day, that many of you have been doing for many years. Dementia-inclusive communities, dementia-friendly communities, these are an idea whose time has come. I want to quickly orient you to what's in your packet. On the left-hand side, you have some brochures and handouts from the Alzheimer's Association and JF&CS. And in the back, you have a handout for Dementia-Friendly America, which is a new national coalition that was launched at the White House Conference on Aging in July. Dementia-Friendly America takes the work of Act on Alzheimer's in Minnesota and makes it available nationwide. And the reason we included this is we want everyone's limited resources to go farther, so we don't want people reinventing the wheel. Dementia-Friendly America has really good resources available for free on their website. And I just want to recognize Brenda Costa and Arthur Bergeron and Tracy Burke and Christine Alessandro, who are leaders in the effort that Hudson, yeah. So they're from the towns of Hudson, Marlborough, and Northborough, which are several months into the process of becoming dementia-friendly communities using these materials. And in fact, they went to Minnesota in September to learn directly from the Act on Alzheimer's team. So these are good people to know. And this is sort of a theme for today, is that we want to make our limited resources go farther and have the maximum impact by sharing what we know and collaborating. On the right side of your packet, you'll find the program for today. And you will also find a sheet thanking our many sponsors and collaborators. And I just want to say, without these organizations and individuals, today would not have been possible. So thank you to all. And on the flip side of the thank you sheet, you will see a list of all the organizations that were featured in the slideshow that was playing during registration and contact information. Just a few housekeeping notes, and then we'll move right along. There are restrooms in the hall. Please use the rear door only for emergencies. So there is a door there, but we would like you to enter and exit through the door you came in through. Help yourself to refreshments and coffee at any time. If you are getting CEUs, you need to make sure you sign in and sign out of today's program. And you will need to complete your evaluation before you leave, and then we'll give you your CEU certificate. And we hope everybody will complete the evaluation. And now, one other thing. So the sticky notes and pens on the table are for an exercise that we're going to do later. I'll explain that at the beginning of lunch. So I'm just going to keep you in suspense for now. And now I'd like to introduce Rima Zelfin, the CEO of JF&CS, who will welcome you. So this is for amplification. This is for the video.
Okay. Yeah. So okay. Am I doing it all right? No. Okay.
You have to talk.
I have to talk.
Be amplified by this one, but keep this one near. Yeah.
You know, this is too. How can I just talk to this one? Okay, let's do that. It's just
No. You have to just hold it here. You go ahead.
You know it.
Talk into this one.
Okay, but hold this one.
Yep, you got it.
You know, it takes a village to have me speak. I don't know. And it's a good thing that there is a village. We have like 500 employees, and they all take good care of me. What can I say? So thank you very much for being here. And it's great that it's a sold-out event. And it's actually not, because it speaks to what a issue it is in the community and how it takes a village to take care of people with Alzheimer's and their families. So Beth actually told me yesterday that every 8th person who is over 65 has Alzheimer or dementia. And it kind of took me a while to marinate that thought, to really understand the significance of this, because those people don't live in isolation. They have families, they have children, they have neighbors, they have friends. So I don't know that there is anybody in Massachusetts, or the world for that matter, who is not affected by it somehow. Some directly, some vicariously, but we all are touched by this. And this is just kind of a sobering thought that this is. And it's not going to diminish, because as baby boomers age, and we all know the statistics, it's probably going to be even more. So when we look at the families and neighborhoods, I'm reminded of our tagline: we care for generations. That's what we say. And it means, different things to different people. It could be that we have 3 generations in one family that are our clients, because we serve people from adoption to bereavement. Or it may be that there are 3 generations of volunteers. Or it may be that we care for a person with dementia, but in reality, we care for 10 or 20 other people, because it affects the whole family and the whole community. So I'm glad that there are people in this room who represent different segments of the community. And somewhere there is a slide behind me that shows you that. See? I'm telling you, it takes a village. So, and I think that's great, because until we all come together, clinicians and non-clinicians, police, libraries, members of the community, I don't think we will begin to get the community ready and make it a friendly place for people with dementia and their families. And I want to give a special thanks to Lebowitz's family, who were our inspiration and supporters and friends, and they still support and inspire us. And Lisa and Beth are here, and their mothers had dementia, and I'm thinking, what is the better way to honor the memories of their mothers by supporting a program like that? So thank you very much. And now I want to introduce Beth. And you have to speak to here, but
Okay,
hold here.
I know.
All right.
It sounds very confusing.
Very
Thank
confusing.
you.
Yeah.
Thank you. Thank you so much. I think this is just so amazing, and I'm just so proud to be standing here today and seeing all of these faces in the room, and to be a part of this symposium. And on behalf of my entire family, we are so proud to support the work that JF&CS is doing in this area, and also just how pioneering they are in the area of Alzheimer's and dementia, and support for caregivers. And it has affected our family personally, and that's how we started to have an interest in making gifts to the field of Alzheimer's. But it's so we have come to the memory cafes and to all the other events that JF&CS is providing and hosting, and we're just so proud to support JF&CS, because they are doing such amazing work, and it just makes us very proud as a family. So thank you. And so thank you all for participating, and I just want to introduce Alice Bonner, the Massachusetts Secretary of Elder Affairs. Thank you.
I feel like I'm playing a game of Twister or something. I'm going to be like Oliver. Well, thank you very much, and thank you to JF&CS and the Levovitz family. And this is just an incredible group here today, and I'm so pleased to be here. I bring you greetings from Governor Baker. I'm going to have to join him at around 10 o'clock, so I'm going to leave here to be going to Worcester, where he's at another aging event. But I was also earlier this week at an event where he spoke about his personal experiences with his mother who has Alzheimer's and what the family went through and how they coped and the things that helped them. So this, here in this state, and I know we have colleagues from Wisconsin and other folks here in this state, you have a lot of people in state government as well as all around us, as we know, for whom this is a very personal issue. Myself, some of you have heard me talk a little bit about my mother. My mother's 85. She lives in Northampton. She has mid but progressive, stage of Alzheimer's, and she lives alone independently with a companion and lots of interactions from all of us. But her language has really been hit hard. So when she speaks, she doesn't have really words that you can understand. So in terms of dementia-friendly communities, she'll go into a shop and say, I need the thing with the, over there, and it's for at my house, and you know what I need, and nobody really knows what she needs. So relying on communities and beyond just accepting people with dementia, but moving toward being helpful and promoting and wanting people with dementia to be living independently like that really takes quite a bit. So she does drive. Her driving, she drives with me and others all the time. She's been evaluated to be able to do that. And so her car battery died. She didn't have a car. So even though her language is really, really impaired, she's a musician. And she's a singer and a dancer. And as many of you know, through programs like Music and Memory and others, music can be very well preserved. And she can sing and dance and do all this. So she performs. So the day after her car battery died, she had a rehearsal. Now, my mother was a dancer at the Roxy Theater in New York, and she would never miss a rehearsal. She takes this very seriously, even though it's completely volunteer. So I call up the people in her group, and I said, is there anyone who can give my mother a ride to rehearsal? Now, she lives 2 miles from where they were rehearsing. Not one person was available to give her a ride. So what do you think she did? She walked. She doesn't walk 2 miles normally. She's pretty healthy, but she never would have missed a rehearsal. So, having people who will step up and do things, and this is not a Medicaid covered service, taking my mother to her rehearsal, right? So, not everything with people who have Alzheimer's or dementias is about medical care. As a matter of fact, most of it isn't. It's about how they want to live their lives. And how many people have come up to me, do you think, and said, we're really worried about your mother. Maybe she should, she should be living in assisted living. Maybe she shouldn't be living in independent. And every time, I go to bed at night, it is on my mind. It is really on my mind. Have I let it go too far? Have I, is the risk too great? And we just keep increasing services in the home. And so, again, this notion of choice and autonomy and respect for people as they are going through the stages of dementia, and as long as they can still say, as my mother says to me, I really want to be in my place. She calls it my place. And of course, my father's stuff is all around. So very personal stories. I know everyone in this room has them, but I just want to thank you for all the work that you do to bring dementia-friendly communities, act on Alzheimer's, and all these wonderful programs. Thanks to Christine. I know she's going to come in and talk to us about how things are going in Hudson, Northborough, and Marlborough. And really, there's a great opportunity here. I think we have 351 cities and towns. But to imagine every single one of those being dementia-friendly and having really robust services for individuals with dementia in some way, dementia, memory cafes and others, I think that is doable. It may take us a while, but I think it is doable. And working with, our great partners at the Alzheimer's Association, Jim is here, Mike Belleville is going to be speaking next, as well as many, many other partner organizations. It does take a village. It's going to take 351 villages in Massachusetts. But we are really well connected with the folks, again, in Wisconsin, our colleagues there. We were just on the phone a couple of days ago with Minnesota, with Olivia, and with Ian Kremer from LEAD, which is another national organization. So it just feels like the stars are starting to align a little bit, thanks, to funding of great projects like the ones we have here and so forth. So I think that this is really possible. And as the other speaker said, 1 out of 8 people in Massachusetts has Alzheimer's. That's about 125,000 people. It's currently about 12% of our population. It is going to triple. Those numbers will triple by 2050, maybe even before then. And so now is the time when we need to be standing up these programs. I wanted to share that Massachusetts, like all of the states under NAPA, the National Alzheimer's Project Act, has a state plan. I wanted to just briefly tell you the 5 major components or major recommendations in our state plan. It's online, you can look it up. But it is number 1, improve access to services and information for individuals with Alzheimer's, improve and expand support and education for family caregivers. That was number 2. Number 3, develop an infrastructure for enhanced quality of services within the medical community. I was a geriatric nurse practitioner. I was in practice for about 25 years. There is so much we need to do with our colleagues in the medical community, nurses, physicians, PAs, social workers, to really educate them about Alzheimer's. Number 4, improve public awareness surrounding risk factors and risk reduction for Alzheimer's disease. And 5, create a set of statewide recommendations for guidelines and minimum standards surrounding quality of care in all care settings, home care, hospital care, nursing home care, et cetera. So I'm proud to say that Elder Affairs in Massachusetts recently received a $600,000 grant from ACL, and it's in the Alzheimer's Disease Supportive Service Project. And that the objectives of that grant, there are 2 main objectives. 1, create and sustain a comprehensive dementia-capable home and community-based services system with no wrong door access for individuals with dementia and their caregivers. So we have a system in Massachusetts, as I know I was talking to the folks from Wisconsin as well, where we have no wrong door because we have Aging and Disability Resource Consortia, or ADRCs. So that means in any community in Massachusetts, you can call up a phone number. We have a new phone number through a call center called Mass Options, but you can also call up your aging service access point. So that's what Christine has with BayPath, for example, in Marlborough. And you can get information that you need about aging services. What we're doing in this grant is really enhancing what we're doing around dementia-specific and caregiver-specific services in every single part of the state through this no wrong door. What we don't want to happen is for someone who is a stressed out caregiver of an individual with dementia to have to call 5 different places to get information about something like, how do I get respite, or how do I get a homemaker? So we want that to be easy, and that's what Mass Options is. We have specially trained call center operators who've gotten additional information on how to get people to the Aging Service Access Point, to the ADRC, to the experts who can do this. Within the ADRCs and the ASAPs, we also have caregiver specialist programs for family caregivers. So we do receive some federal monies to be able to have programs for respite in each community, to have support groups for family caregivers, and again, linked to other information and resources so that if there are memory cafes in a community, we can do that by letting people know through the Family Caregiver Specialist Program. So again, we would love to see all of that work increase, and we hope that through initiatives like Dementia-Friendly Communities and our new grant, we will do that. The second part of our grant is to ensure access to a system of culturally competent, high-quality, dementia-capable home and community-based services. So in our gateway cities like Lawrence and Worcester and Springfield, places like Holyoke that have over 50% of their population Latino now, we want to make sure that we understand dementia and caregiving in those cultures. We, before coming to the state, I was working on some research at Northeastern University with Hope Turner, one of our colleagues, and again, researching caregiving in other cultures is really interesting, and it's important that we don't make assumptions about what those individual caregivers need as well. So it is National Family Caregiver Month, November. We intend to have that be every month. I talk about caregiving every place I go. It's in every presentation, it's in every conversation that we have, and I think it's important that all of us are ambassadors for the invisible caregivers out there, the people who could not come here today. They could not get here because they couldn't leave someone with Alzheimer's in the care of someone else. You know, I can't quickly and easily explain to someone else how to understand my mother. And I know exactly what she's trying to say to me because, you know, she's my mother and I've, 58 years with her. I get her now. But I can't easily explain that to someone else, and that's the case for many caregivers, and also around a lot of physical care that people at the later stages of Alzheimer's have as well. So I, again, just want to thank you. We have a number of staff members here. I want to just say Martha Waldron's here, our Director of Communications, if she wants to stand up so you see her. If you want to, she does an absolutely fabulous job. And we are filming Senior Scene with some of our colleagues from the Alzheimer's Association. We're talking about dementia, talking about caregiving. That's a little TV program on cable TV. Anna Karchmer is here. Anna does a lot of our work and kindly translates my remarks into Spanish and then laughs while I try to say them, but usually rescues me during Q&A. Anyone else from Elder Affairs here? I don't think so. Anyway, so it's my pleasure next to introduce Mr. Mike Belleville. He's a self-identified optimist. I could have said that as well. I think that's great. Mike has become an advocate for individuals living with Alzheimer's disease after receiving a diagnosis of younger onset Alzheimer's in 2013. Mike and his wife Cheryl have been married for 33 years. They have 3 children and 4 grandchildren. He worked as a telecommunications technician at Verizon for 17 years, and he served in the Rhode Island National Guard. Mike currently serves on the Alzheimer's Association Board of Directors, their early stage advisory group, and we're very fortunate to have Mike here with us today to share his story and perspective. So welcome, Mike, and thanks very much, all of you. Good luck.
Too, right? Good luck, thank you. Okay, I'll try this. This kind of looks like multitasking. It's one of my challenges. Okay. Ooh, it moves. Good morning. Good morning. My name is Mike Belleville. I'm 54 years old, and I live in Douglas with my wife of 34 and a half years and our 18-year-old son. We also have 2 lovely daughters who are 32 and 31, and both are married. We also have been blessed with 4 grandchildren, and a 5th is due on Valentine's Day. Yeah, it's pretty cool. Unfortunately, 2 years ago, I was diagnosed with younger onset Alzheimer's disease. As you can imagine, this was quite a shock to myself and my family. I am in the early stages of the disease, but I have certainly felt some of the stigmas associated with it already. We have had to sell our home. I no longer drive. And just a few weeks ago, I left a job that I loved for 18 and a half years at Verizon for good. I am home all day now, and I am staying as active as I can. We love the town of Douglas. We moved here 10 and a half years ago, and I got involved the best I could. I was a vice chair of the town school committee. I was vice chair of our town's capital improvement committee and treasurer of our town's democratic committee. I no longer participate in any of these volunteer opportunities for obvious reasons. However, I do volunteer at our senior center, helping people, mostly elderly, with their cell phones and iPads and laptops. In fact, they call our group Mike's Google Gals. And I truly enjoy my time with them. The reason I'm here today is that I would like to help make our town even better. I would love to help make them a dementia-friendly community. The reasons may be selfish on my part, but I also know that many, many other people would benefit from it. The reasons are many, but I'll only mention a few. I think the biggest of them is to bring awareness about the disease. I know there are many folks living with dementia who may have chosen to remain quiet and isolated because of some of the stigmas associated with it. I truly believe the more people are educated about it, the better it will be for those of us living with the disease, as well as the caregivers. Safety is another reason. We need our local police and fire and rescue folks to be better informed and trained in handling people with dementia. Our local businesses, such as restaurants, shops, even the local library, can be enhanced so that people living with the disease feel that they are understood and feel safer. I feel that a dementia-friendly community will help ease the stress that those of us with Alzheimer's feel every time we walk into a place of business, and will keep us engaged and part of a community for as long as possible. Thank you very much.